In this video, we're going to give you the scoop on physical therapy, why what you get differs so vastly from one practice to another, what physical therapy should be, and how you can tell you're getting good quality physical therapy. Hey, it's Glenn here from mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button. Any links we mention in the video can be found in the description below. And as always, the information we provide is for education and demonstration purposes only. With that out of the way, let's get into it. Physical therapy is a standard term that most people are familiar with. However, people's understanding of physical therapy and experience with physical therapy can be vastly different. But why is that? We're going to explore why there's such a difference, what you should expect from physical therapy, and 5 simple signs that you may not be getting the best quality care. People seek physical therapy when their ability to function is limited, typically due to pain, loss of motion, surgery, or weakness, and the primary goal is to restore a patient to their prior level of function. A physical therapist thereby serves as a guide for the patient, providing an accurate assessment, prognosis, and plan of care. And they have a vast array of tools they can use to accomplish that goal. Over the last decade, there's been a lot of emphasis on evidence-based care, meaning using only treatments that have been proven to be effective by a consensus of peer-reviewed research. Knowing that, one would expect that the care to be the same regardless of where you went. Pretty logical, right? It makes sense to use only the most effective treatments. Nevertheless, physical therapists are still instructed and use interventions not supported by evidence. There are 4 main reasons why these practices persist. Number 1, patient expectations. The use of unproven interventions is so widespread that it's become what people believe physical therapy entails. And any deviation from those expectations is often met with patient dissatisfaction. In order to keep patients from going elsewhere, they perform those interventions and end up further perpetuating these beliefs. Number 2, empathy. Physical therapists are generally nice and caring people who want to see you get better. Pain is a major reason for the loss of function, and using treatments that offer temporary relief to make a patient feel good can be very rewarding for the therapist as well. Unfortunately, this also causes reports of improvement that quickly fade thereafter. Number 3, education. This is by far my biggest gripe. Physical therapists are products of their education and subject to the bias from their instructors in their school. While there's a standardized licensure exam, the curriculum for the schools is not the same. And unfortunately, some therapists just never expand or challenge the belief system that they inherited from their educators. I've been that guy. I basically just didn't know any better and just regurgitated everything that I learned in school. Number 4 is fear. There's comfort in conformity, and the web is riddled with personal attacks against anyone that speaks out against outdated, illogical, or unsupported interventions, as I'm sure I'm going to soon experience. Even in the face of evidence, some people are willing to defend their position ferociously, resorting to anecdotal support and are unopen to the chance that they might not be correct. So how do you know if you're getting not so great therapy? Well, here are 5 signs. Number 1, most of your time is spent with hot packs, cold packs, stim, and ultrasound. While modalities like hot packs, ice, and stim can provide temporary distraction from the pain, they in no way fix anything and should be used sparingly or at the discretion of the patient. As far as ultrasound, despite its continued use, there's just no strong evidence to justify it. For me, it's a huge red flag. Number 2, you get a ton of hands-on treatment. Manual therapy such as massage, stretching, joint mobilizations, trigger point release, dry needling, instrument-assisted soft tissue mobilization produce no long-term effect and are not supported by strong evidence. It can feel like it's helping, but it's really just temporarily providing a different sensation. Any perception of improvement will fade shortly after, and any range of motion that is gained is gone in about 10 minutes. Do you notice you're always measured immediately after stretching? There's a reason for that. And yet, even that barbaric stretching of your total knee, gone before you leave the clinic. Number 3, you're doing the same exercises you do at home. Exercises and progression of exercises are important and honestly the most important part of your recovery. Your exercises should be changing and challenging. But if you're doing the same exercises you're doing at home, I'm not really sure what the point of your session is. You shouldn't be thinking, so let me get this right. I'm paying you to watch me do the same exercises that I do at home. Number 4, you're not learning anything. Patient education is one of the best skills a therapist has in their toolbox. You should never leave physical therapy not knowing the reason you did something. Education leads to understanding, and understanding leads to compliance, and compliance is the most vital aspect of your recovery. your PT should be able to justify the things that they do. If they can't give you a logical explanation that you understand, they probably shouldn't be prescribing. Number 5, they catastrophize your injury. Words matter. Expressions such as, wow, you're really messed up, or this is the worst I've seen, have been proven to have negative effects on patients in their recovery. You should feel positive about your interactions and not filled with fear and doubt about your injury or recovery. So there we go, a few reasons why the therapy you get can differ from place to place and therapist to therapist. Remember those 5 things you should watch out for if you go to traditional physical therapy. And keep in mind that interventions used by physical therapists are more often based upon the course that they just took and how much money they spent versus the actual efficacy of its use. Before we go, we have several upcoming topics including how you got injured, what your MRI won't tell you, and our top tips for getting the best recovery. So if you'd like to see those and more, please hit the subscribe button and we'll catch you on the next one.